罕盟一直係倡議咧，香港政府制定罕病嘅政策。世界其他國家嘅罕病政策到底又係點樣嘅啦？香港又需要點樣嘅罕病政策啦？喺出邊嘅展覽版咧，亦都可以咧多多少少知道世界各地嘅罕病政策而家嘅評價到底係點樣㗎？喺呢個部分，我哋邀得兩位嘉賓，分別咧就係國際罕見疾病聯盟嘅主席 Durhane Wong-Rieger 博士，以及香港罕見疾病聯盟副會長曾建平先生。兩位分別會講解從病人嘅核心需要綜覽罕病政策，以及係病人對香港罕病政策嘅期望㗎。兩位嘅講解咧就稍後之後咧就會亦都有問答環節。大家如果有相關問題咧，我哋工作人員咧亦都會準備，等大家咧可以喺台上交到發問㗎。而家我哋先有請國際罕病聯盟嘅主席 Dr. Durhane Wong-Rieger. We will now invite Dr. Durhane Wong-Rieger to share overview of policies for rare diseases in context of key patients' needs. Dr. Wong-Rieger, please.
Thank you very much. And my huge thanks to KP for the invitation, and huge congratulations to the Hong Kong Alliance for Rare Diseases for the great success that we've had here. I have to start always with a bit of a apology for not being able to speak to you in Chinese. I was actually born in Hong Kong, lived in Hong Kong when I was about 2 years old, so I was about 12 years old. Then we moved to the United States. And like many children, we did not continue to speak outside of the home. My mother always said to me, she said, one day you'll be sorry. So I guess we are. But I do apologize. I want to thank you very much for the opportunity to be here. And certainly I think, and as you will see, it is such an important occasion for Rare Disease Day to have not only the patients but the rest of the community together. I'm going to speak to you in my role as Chair of Rare Diseases International, but to also let you know that I'm also President of the Canadian Organization for Rare Disorders. Some will know that I have children who are born with rare conditions, and I've been involved very much in terms of patients and patient organizations for many years. The objectives, basically, I would like to talk a little bit about what is happening in different countries with regard to rare diseases, what are the policies that are given in different countries, and also I think there's an interesting question that examines which country has the best practice. So I'm not sure that's an easy question to answer, but we will talk a little bit about the differences there. And then why, of course, is the policy of rare diseases so important? I think, as you know, there are lots of advances that are taking place in rare diseases, but in many cases, policy tends to be much slower than the actual advances in science, the advances in care, and certainly the advances in terms of opportunity. So it is very important that we talk about how do we get policy at the same level as the opportunities that are available. And what is it that should be included in policy, and what are the components of a rare disease policy? I remember when we first started talking about rare disease policy, I was not real sure what a policy is. I'm not sure if many of you will understand, but somebody explained to me very important. My husband actually teaches in business policy. So when I was asked him, what is policy anyway? He says, policy is how you decide to allocate money. Where your policy is where you will put your money. And that to me that made a very good sense. And that's why policy is so important. Because what the government's policy is, what the hospital's policy is, what the company's policy is, this is where they're putting their money. So it's very important that we influence policy. The policy says what is important, and what's important is where we will put our money. So it's very important that we influence policy. So these are the principles for rare disease policy that I'd like to talk about. Just four. One is equity. Equity doesn't mean everybody gets the same. Equity means we give to people based on what they need. And sometimes that means that those who actually have a bigger need will have to get more in order for it to be equal. So we don't want to give everybody the same. What we want to do is give so that people end up at the same place. And of course, for rare diseases, as we know, equity is much more important than equal. Universality. is another big principle of a policy. A policy says we will make sure that everything and everybody is included. So access to health and other services, but it means then that it doesn't matter the age, doesn't matter the gender, and it obviously doesn't matter in terms of your wealth. But in this case, also universality means it doesn't matter what kind of condition that you have. So because you have a condition that is not well known, it doesn't affect many people, universality says we must include all of that. Comprehensiveness is very important in terms of rare disease policy because as we know, in order to actually care for not just rare diseases, but for any condition, we have to look at everything. Obviously diagnosis, care, but also community support. And what are the kinds of educational support, work support, other policies that would actually help beyond just the care for the condition itself. And also what we want to talk about is engagement. And this is where I think this is why the Alliance is so important. Because with a policy that says people who are affected, families that are directly affected, must be included in the actual delivery, the design, the actual evaluation of all the care treatments. So patients, families need to be part of the actual program. So these are the 4 principles. If you meet those 4 principles, everything else is easy. Of course, meeting those 4 principles is not that easy. So this is our challenge. I want to go back to talk a little bit about what for me has been a very important part of, and I see it in terms of the sponsorships that we have as well. Why, in fact, rare disease drugs, or what they call orphan drugs, are so important in terms of rare diseases. Because what we do know is in the history of rare diseases, the rare diseases have been very much involved in terms of drugs. The drug development, the drug discovery, the drug availability has been a real part of actually being able to improve diagnosis, improve care and treatment, but also in terms of advancing the science and the research around rare diseases. Without the drugs, quite frankly, there would be very little in terms of actual rare disease advancement. And I think this is very, very important. The history of almost every rare disease advancement has to do with where those drugs are. And not just because drugs are the only way to treat a rare disease, but drugs have actually helped to stimulate the research and the actual care and treatment. Drugs and the orphan drugs have also been very involved in terms of patients and patient development. So most of the patient groups, as we know, have developed around the need to have a treatment. And I'll give you a few examples around that. And I think it's really important to understand why then it's so integrated between rare diseases and drug development. What we also know, and what I'd like to also talk about, is the fact that rare diseases are global, and integration of rare disease alliances around the world has become so very important. I think, as you heard before, because the number of patients with a rare disease in any one country, in any one space, is so small, it is important to work globally, but beyond that, of course, is also the need in order to, as you just heard, in order to have enough patients, to do the research, to actually demonstrate the value of the therapies, and also to be able to continue the advancement. So for us, it's very important to be involved globally, but beyond that, of course, patients, family, clinicians are all working globally in order to share that knowledge in order to advance. This is my little picture of orphan drugs. Some of you will know the history of orphan drug development. Prior to 1983, the United States, right, had the first orphan drug policy. I think that many of you know, 1983. Before 1983, in the decade, the 10 years before 1983, there were only 10 new drugs for rare diseases. You know, the reason why they're called orphan drugs is not because the diseases are orphan, it's because as companies were developing drugs for these conditions, they found that it wasn't very profitable to make a drug for a small number of patients. So they would actually take the drugs and they put them on the shelf. They orphaned them. They stopped developing them. is actually in the U.S. The person on the left here is Abby Martin. Abby is probably, she's a mother. She had a son who had a rare disease, Tourette's syndrome. And he was involved in a clinical trial. The clinical trial, the drug was not really designed for the rare disease. The drug was actually designed for a much bigger disease. But they thought, okay, this rare disease might also benefit from this drug. So they put a number of patients that had Tourette's on this drug. What happened was that the company discovered that the drug wasn't working for the big patient population. So they said, we're going to stop the clinical trial for this drug. We're going to orphan the drug and put it on the shelf. Abby said, but that's a tragedy. My son is on this drug. It's actually working for him. We need to continue the clinical trials for this. And the company said, we don't want to do it. There's no profit in it. Even if we actually were to demonstrate that it worked, because the patient population is so small, we will never make any money back. We will stop. So Abby got very busy. She was head of the National Organization for Rare Diseases in the U.S. She actually put this in her newsletter. Another mother who saw this lived in California. She wrote to Abby and says, my son is on that same drug. What can we do? She said, you're very lucky because your congressman is Congressman Waxman, Henry Waxman. He was a very important congressman in the U.S. who was trying to advance the Orphan Drug Act, which basically said we need to give extra support to companies to develop drugs for rare diseases. Because if we don't, nobody will develop them because there's no profit in them. We need to pass legislation that would support that research and development, give funding, give incentives for companies. So Henry Waxman has been doing this for the last couple of years. Nobody paid attention. So she said, write to him. You need to start the campaign. They began the campaign. In doing this campaign, how many of you know Jack Pilgrim, who's an actor? His brother saw the campaign and said, we can help you. My brother is Jack Pilgrim. He's a famous actor. He has a television show. We will put this on TV for you. And so he got involved in the campaign. We'll go through the whole story. It's a fascinating story. But at one point, they were holding hearings in the parliament. And they said, we would like to invite patients to come do a demonstration at the parliament, in the Capitol. And so they asked Abby, says, can you bring a whole bunch of patients to come like you do here and come to Washington and do a march in Washington? And she said, are you crazy? It's February. It's the middle of winter. There's snow and ice. My patients are in wheelchairs. We cannot come to Washington. And Jack said, no problem. We have a street in Hollywood that looks just like Washington. We will fly the patients into Hollywood, and we will film it there, and we will now show it at the house. So if you ever see the documentation around the Orphan Drug Act, no, those patients were never in Washington. They went to Hollywood, they did the demonstration, they showed it in the... Anyway, at the end of the day, what they were able to do was pass the Orphan Drug Act. And this was very important because it was the first piece of legislation that was really designed to support the development of drugs for small patient populations, recognizing that it was very hard to develop these drugs, that there wasn't going to be a lot of profit in these drugs, and we needed to support the research and development. This is the trajectory of the orphan drug legislation that's happening in other countries. As you can see, Japan, Australia, Korea, other countries. Europe was the biggest group that said we need to have orphan drug legislation in Europe. 1999, 2000, they passed the Orphan Drug Act in Europe. Since that time, in the years since the Orphan Drug Act, there have been now more than 500 gene therapies for rare diseases. None of this would happen without that very beginning of the Orphan Drug Act. Since that time, we've seen rare diseases actually change rapidly from the point of view of diagnosis, from the point of view of research investment, from the point of view of treatment, from the point of view of support. So orphan drug legislation has been critical in terms of the development of the knowledge, the diagnosis, and the care and treatment in terms of research. And as we know, drugs are probably the most important form of medical treatment today. The Taiwan Patient Association, I won't go into a long history of it, but many very, very successful foundation for rare diseases. It was again started by two parents, a mother and a father. The way they got started was that the father had a son with a rare disease. Total different rare disease than the woman did, but there was the thought that that drug might be able to work. So they borrowed the drug. He borrowed the drugs from her in order to have his son treated. And this was the beginning. These two parents got together and said, we need to get the government involved in terms of policy on rare diseases. We need to start an association to support patients with rare diseases. And very powerfully said, we may not be here forever to take care of our children, but if we have an association, it will be there to take care of our children. So again, parents and patients and the quest for drugs have been integral towards drugs. The Type 1 Foundation for Rare Diseases is in many people's respects one of the most successful rare disease organizations in the world. And you can see how over the years they've been able to continue to grow their organization, continue to raise funds to provide support, and continue to get the governments to invest in the support for rare diseases and the support for treatment for rare diseases. So this is the kind of progress that has also begun from simply two parents who got together. The Japan Patient Association, I won't go through our history, again starting with patients, starting with parents, who again came together to say we need to be able to work together to actually provide association that will support patients with very small diseases. As we know, alliances, foundations, associations of rare diseases are so important because each one of us, with our own rare disease, are not going to be able to make enough impact. But if you can come together, what you can do is actually create a very powerful influence that can actually change a great deal of policy. The Japan Patient Association is again one of those very, very successful examples of patient association. And they actually do work very closely with the governments in terms of policy change, in terms of legislation. This is Europe, and I'm not going to go through long, but the European Union actually came into rare diseases in about 1999, in about 2000, and about the same time as the Union was actually developed. The first time the countries came together, there was a wisdom to say, we need to create our own alliance, we need to create support for rare diseases. And so this has been the beginning. It's probably the most important advancement because in Europe, they not only focus on rare diseases, on drugs, they focus on care and treatment. They focus on clinic. They focus on being able to have comprehensive care. And the important thing to know about what's happening in Europe is because they are able to have cross-border care. It means it doesn't matter which country you live in among the 28 countries in Europe. If the expertise is in another country, you as a patient have a right to get that care in another country. It's very important. And then, as you can imagine with rare diseases, we cannot have experts in every single disease, in every single country. But if we have a large enough group of countries, and we can have the patients move to where the expertise is or get the support, then we actually can have good expert care for rare diseases for a large number of patients. So the Europeans have been very, very not only fortunate, but they've used the advantage of being a union. Most of us don't have quite that same sort of access, but it's been very important because the research and the development that's taken place in Europe has actually been able to be exported elsewhere. So this is very important as well. So it's not just that they are doing it for those patients, they're actually doing research in genetics, in genomics and testing, diagnosis, doing research in terms of standards of care, what's the best care. They're doing research obviously in terms of treatment and the ongoing support in terms of getting the evidence around treatment. You heard earlier, your Undersecretary said, one of the challenges in terms of providing treatment for patients with rare diseases is because the clinical trials are done on very small numbers. And oftentimes you don't have enough evidence when the drugs are first launched to be able to say, is it going to work and how well is it going to work. But if you have enough patients who are on those drugs over an extended period of time, you can actually collect that information to be able to say, Sometimes if we say, yes, it works really well and it works for these patients, sometimes it may be to say, no, it doesn't work so well and maybe we might do something else. But it's important to have a large number of patients that can be involved after the trial to gain collecting that information. And the Europeans are really one of them, are able to, because they have 28 countries working together, are able to focus on collect that information that will benefit everybody. The challenges for other countries are a little difficult, but they've also put together national plans. Every country in the European Union was directed by the EU to say, we must develop a national plan for rare diseases. And the plan includes diagnosis, it includes clinical care, it includes support, it includes ongoing research, it includes patient organizations. The other thing that they said, very important, is that every plan must have patients who are sitting on an experience base. Patients and families must be involved in every stage of that development. This has been very important. And countries have developed a plan. They provided funding to develop those plans. Out of those plans, very importantly, this is the timeline, has been the development of what are best practices in a national plan. If you're to develop a national plan, here is what must be included. This says, here are the key elements when you talk about what's necessary. Obviously, it includes how do we actually diagnose it? What are the ways in which we're going to be able to do research in it? What are the support in terms of therapy? So they're in your plan, there has to be an indication. How are you going to provide ongoing support? This has been actually a very important asset. For us in Canada, we use all the things that the Europeans were doing to develop our own plan for Canada. It meant that we didn't have to start all over to try to say, what is it that we want to put in a national plan? What are the best elements? It also helped us when we're trying to sell the plan to the government to say, here's what other countries are already doing. Here's what best practice looks like. We would like to develop a Canadian plan that will look very much like that. So this has kind of been very, very important in terms of the development. What the Europeans have done beyond just having a national plan, this is what I think has been instrumental. I mentioned the fact that we have cross-border care in Europe. What this means, though, is that they have developed what they call European Rare Disease Reference Networks. This is like a center of excellence, so it'd be like your very best hospitals here, that are able to say, we're going to do it right across all of the countries of Europe. It means that we will cluster rare diseases based on the type of rare diseases, so we can have eye diseases, which they do have a cluster for. They have a cluster for bone diseases. They have a cluster for immune diseases. They have a cluster for storage diseases. So they build clusters of metabolic diseases, and they basically say, here are the diseases that are somewhat alike, and they're alike because in many cases, the specialists who work on those diseases are all clustered together. We will set up sites in Europe where we will have experts, but what these sites will do is connect to other sites. And we will then be able to have a network across Europe where patients may go to get diagnosis, to get treatment plans, to get ongoing support, not because they have to be at centers, but because their own clinicians are connected to these centers. So this has been, again, a very important development. And these reference initiatives are also supported by the European Union in terms of funding. For all of us, this is going to be very important because what they will continue to do is to advance diagnosis, care and treatment, and develop standards of care that we can all reference. They may not be the same for everybody, we may not always use them, but they will be able to serve as a reference for everyone. So these are the European reference networks. We're quite excited about actually being able to continue to follow them, and I'll tell you a little bit about what we're doing in Canada that hopefully will build on what these reference networks are about. So in Canada, as I said, we decided that we need to develop our own rare disease strategy. Canada, actually, is a small little country, and it's, right above the U.S., which is a very big country, but the United States, as many of you will know, has a very different kind of healthcare system than almost anybody else in the world. Our healthcare system is much more like European healthcare system, so we have been very working and referencing the European. Well, what we did do then was to say, okay, we need to develop our own rare disease strategy, launched it in 2015. First part of it is to improve detection and prevention. Second is to make sure that we have clinical expert centers that are set up to provide best practices, community support, including the patient organizations, including disability service, sustainable access to therapies, and research. So those are for us the same 5 elements that we saw in the European Medicine Plan. What we've done then is put them into a strategy for rare diseases in Canada. We're quite excited by the fact that our largest province, Ontario, last year, on the occasion of Rare Disease Day, committed to implementing the strategy. So last year, they set together a working group to develop a working plan for how we're going to actually make this strategy part of our healthcare delivery system. We were very happy to be part of those working groups, and this year, they actually announced then the first plan of how we're going to actually start to develop it. So I think that, Brian, you'll be very happy to know that the Hospital for Sick Children is very much at the core of this. The Vice President of the hospital is one of the 2 key leaders in terms of putting the plan, and we've identified 3 important first steps. One is to have much quicker diagnosis using genomics. So we will be able to leverage the work that's being done in genomics in order to get as much as possible, a rapid diagnosis for patients who have rare diseases, starting with not just newborn screening, but a plan to actually provide genomic exome sequencing, genomic sequencing to patients who may in fact be identified as having a potential rare disease. And we, Canada actually is one of the leaders in the world in terms of genomic research and genomic testing. Second aspect of it is having a model for clinical care. And what we've described it as is a very important book called a hub-and-spoke model. The idea with rare diseases, of course, is you cannot have experts everywhere. What you can have is a center which will be the center of expertise, and you will have that center connected to many other sites where they will get ongoing training and support in order to manage the patients. That's for the patients to be able to be cared close to home. In Canada, as you know, is a huge country, so it's not that easy. Even Ontario is a huge province with many places that are very far north. So the idea would be that patients could, in fact, be referred to a center to actually get a diagnosis if necessary, but more importantly, there will, in fact, be clinicians and other support units that will be connected to a centralized site, what they call a hub-and-spoke model. So it's a very important. Part of it is ongoing training, part of it is ongoing development in terms of the education. Beyond that, ongoing support for the patients who go to home. And then the third part of it is developing patient registries. This is actually hugely important, is that implementing a registry where every patient who's diagnosed, or actually a patient who may not even have an actual diagnosis, can be entered into a registry. One, to be able to be followed by the right kind of specialist and clinician, but also if you don't have a diagnosis. My daughter, who's now in her 30s, has never actually gotten a diagnosis. And so what she can do is be enrolled in a registry. Well, she probably would now. But if she were newly born, could be enrolled in a registry with information, and as much information as possible. And as the knowledge and research develops, you may actually be able to get a diagnosis. And we do know that in genomics, there's huge advances. The more we're doing in testing, the more we're putting that information into a centralized data bank, the more there will be the chance that as a patient gets a new diagnosis, especially if it's a genetic diagnosis, you can go into a reference bank and maybe to identify where other patients who have a similar type of diagnosis. So this is actually quite important. The very important thing of all of this is that many of these data banks are now international. So these data banks then will be ones that are available to clinicians, to researchers, no matter where they're living in the world. There's a huge initial effort that's being made in order to have that information, obviously not in patients' names at times, that will be centralized. And in Canada, we're making great strides in it because not only is the genetic information being put in, into a registry, we're actually adding with it what they call phenotypic information, symptoms. So you have the gene, you have the genetic information, and you have attached to it what are the kinds of symptoms that are actually being manifest as part of that genetic information. So even if you don't have an exact diagnosis today, as that information grows, you may actually have new ones. And what will be valuable for clinicians is that if they have a patient who shows certain kinds of characteristics, you may actually be able to find in that database some information that will tell you more. As importantly, they've created a thing that's very exciting as far as I can tell, I don't know, called a matchmaker. So that your information goes into this database, and they start to match you with another patient, another family that may have similar kinds of information. So again, you may not have an exact diagnosis, but you now will be able to, so at least your clinician will be able to match who are other patients and other families. And as you can imagine, as we're talking about doing research, we actually will have a large database that we can actually develop. This can only happen, obviously, because of the amazing things that are happening in terms of internet, in terms of being able to share information, but also the fact that we're all hopefully going to be globally connected. For us, it's very important because in Canada, we have so many ethnic groups. We have so many different populations that come together. And so we do not have in Canada necessarily enough patients that are going to be able to give us the right information around a certain kind of a rare disease. But we have a large Chinese population, for instance, and they will actually hopefully be able to be referenced back to populations in Hong Kong, in Taiwan, in China, that will actually help us to do a better diagnosis. So this is all very important. As you can see, I get very excited about these things. I just very quickly to just show you Latin America, exciting things happening in Latin America because again, patient organizations, all driven by patient organizations who are saying we need to actually get involved in terms of having rare disease policies in Latin America. And as you can imagine, not so easy in Latin America, where the whole economic development may be much farther behind. So the challenge there, though, and the challenge we're all saying is that we have to have those. I mean, in Latin America, they also are working together across the different countries with patients, with clinicians, with many of the researchers to actually be able to develop consortiums in Latin America. Not that easy, not quite as homogeneous as you might see in Europe. This just points to the fact that in many countries, there's different definitions of what a rare disease, different laws. But again, the goal is to try to be able to collaborate and do more together. And by bringing up what these challenges are and the differences are, is to get the country to actually work more collaboratively. This is the evolution of patient organizations in Latin America, and KP will know is that we've got many good colleagues in Latin America who have actually come to be part of the Rare Disease International and are helping to lead the way in terms of development across Latin America. The good thing about Latin America is that all the countries speak Spanish, except for Brazil, which speaks Portuguese, but they actually can work together. The patient groups can work together quite well because they all speak the same language. A little bit more challenging when we look at what's happening in Asia, because we do bring together the groups and we try to develop an Asia-Pacific alliance. It's a little bit more cumbersome because not everybody speaks the same. So this is the beginning of the Asia-Pacific Alliance. I want to show you some of the timelines around it, try to work collaboratively again for similarities. This is one of the first groupings that we had. I'll just quickly finish up with Rare Disease International. So out of all of this, one of the things that has begun is the creation of Rare Disease International. This is our global alliance of rare disease organizations. Again, a real focus around patients' organizations. The new numbers suggest that there are 475 million people living with rare diseases globally. The word is that if, in fact, all of the patients with rare diseases lived in one country, it would be the third largest country in the world, second only obviously to China and India. That's a huge number of people living with rare diseases. It's a great population to think about doing work on, but it means because they're scattered across the globe, we have to work internationally. We have to work with them as if we could actually reach them. 7,000 rare diseases, as you know, 80% of them are genetic. We still very much today have the challenges. About 50 to 75% affect children. About 30% of those children will never live to see their 5th birthday. This is the challenge of rare diseases for us today. Rare disease treatments. Out of those 7,000 rare diseases, despite the fact that we say so much progress has been made in the work of drug development, only 5% actually have treatments. So we have over 6,000 rare diseases that still do not have treatments. So it requires global action. It requires our working together in order to actually advance the treatment there. This is our first Rare Disease International. We're very proud in terms of being able to pull this together. Reward us at the European level as a huge asset in making this happen. This speaks to different visions and objectives. I will tell you the most important objective is to raise awareness of rare diseases as a global public health issue. This is an issue that is as important as any epidemic, as any other disease that actually grabs the global attention. So what we want to do is to actually get the global organizations, the United Nations, the WHO, the World Bank, all of these organizations that can have such an impact in terms of helping to advance rare diseases, to recognize rare diseases as a global public health issue. So this is something that Rare Disease International has taken on as its mission. And in order to do that, one of the things we've done is start to collaborate at that international global level. So last year, well, this is just some pictures of it. This is as you can see, KT is on there as one of our Rare Disease Council members, and KT has been a huge asset in terms of being able to raise the level of our work that we're doing at the rare disease level. So KP and I have known each other for so many years, and I was so delighted to know that KP has taken such a leading role in terms of Hong Kong. And I will guarantee you that Hong Kong is going to advance so much because of KP. And as you know, we have seen, and I always say, you know, at the end of the day, it's individual patients and its parents that drive each and every one of these. And KP has been such a tremendous asset as it's come into this environment. So we can see how, at a global level, we're going to be able to make those kinds of advances. The most important thing is that, so this is just some information about the Rare Disease International. One of the important things that I just wanted to raise in terms of our category, involved in 49, 50 member countries, 100 plus countries worldwide. What we have begun to do is to actually work with the United Nations. So 2 years ago, we set up the non-governmental organization Committee on Rare Diseases as a partner with the UN. And the goal is to actually get the UN to recognize rare diseases and to include rare diseases in their sustainable development policy. The importance of that is that the United Nations actually talks to the countries and say, here are the things that you must be doing. Here's the United Nations standards. If you are to be considered to be meeting global standards in terms of your care for your citizens, this is what you need to do. And we are trying to make sure that they recognize that rare diseases are part and parcel of all the sustainable development goals for all countries. This is our first council meeting at the United Nations, as you can see there. It was actually quite an impactful event. They told us afterwards we had never had an event that was so impactful as this rare disease community. So we're very excited about it. We brought in there WHO, UNICEF. We brought in many of the other disabilities, the women's, the educational committees, to all come in and say, rare disease is not just about identifying and caring for the rare diseases. It has an impact on each and every one of the goals of the country. We actually were quite pleased to announce a very important statement from at that point one of the secretaries there that said, no country can claim to have achieved universal health care if it has not adequately and equitably met the needs of those with rare disease. That's a very important statement because it says it doesn't matter what level of health care you've got, doesn't matter what level of economic development you've got, as you're actually bringing in systems of care, you must also include those with rare diseases. This is very important. And for us, it's very important because it means that we're not going to wait until you've actually taken care of all the common conditions. It doesn't mean that we have to wait until you've taken care of all the contagious conditions. We're also going to include patients with rare diseases at the same time. This is important. So when you're developing your healthcare policy, when you're developing your program, when you're considering how you're going to actually include drugs, we're working very hard. The WHO recognizes in their programs of essential medicines. And essential medicines doesn't just mean common medicines. It means medicines that are based on what's essential to the individual, which means that we have to find ways in which we're going to have patients with rare diseases, if there's a treatment available, finding ways in which we can. Obviously, we need companies to work with us to make that happen at the same time. The same as companies that work in terms of providing vaccines. We don't say with vaccines, well, you know, we can only give the patients that are living in rich countries. We actually say we want to make sure that no matter where you live, doesn't matter what the economic is, all patients have a right to have access to that level of treatment. We want to make sure they're interested. So this is part of our goal. So this is what we've been working on. The only way we can work with like the UN, WHO, and UNICEF, and Microsoft, is to actually have a patient alliance at that same level. This is why the international has become a very important tool. How do we talk to these other entities? Some of the work we've been doing in terms of advancing that. This is a statement from the new identity. Again, I hope you actually recognize the rare diseases as part of his run for the Journal of the World Health Organization. These are some of the other networks that we work with as a global alliance, and this is and it's that rare disease policies differ across countries. So one of the questions that I know that is asking again is where's the best policy? Obviously, there's no such thing. Policies have to fit into the economics, into the politics, into the healthcare that's available in that country, but there are common elements, and this is what we want to say. And this is where we want to make sure that we're able to think, is that any kind of healthcare policy for rare disease has to include some strategies for diagnosis. And there's some things that can be done in diagnosis that are not that expensive, including some of the newborn screening, including some of the diagnosis around preeclampsia first grade in terms of symptomatic diagnosis. So there's a lot. We do not have to invest in those advanced components equipment in order to do diagnosis. Expert care, again, expert care has become so much more available because of the internet. Any clinician can go into the internet and find out what the best care is for a particular rare disease. We know they do it because patients have had to do it themselves, right? And oftentimes the patient parents know a whole lot more than the expert does because they're spending the time to find out where that is. That information is available. How do we make sure it gets out to all the treatments? Access to therapies. This is a big challenge. As we know, some of these therapies are very expensive. I mean to accentuate the expensiveness there, but it is very expensive. What we need to do is work collaboratively as a community. How do we make sure these treatments are available to patients around the world, regardless of the economic status? How do we make that happen? That means working together to figure that out. We can do that. Obviously, we can charge a patient who's living in lower income the same as we would for somebody else. How do we make that happen? And that means working together. We want to make sure that there is, in fact, in every country, regardless of where that's at. Economic status is, healthcare status, rare diseases, the same as contagious diseases, common diseases like cancer, heart disease, diabetes are recognized that rare diseases have equal status. We would not say to somebody, you don't need to treat diabetes, you don't need to treat cancer, you don't need to treat heart disease, because your economic status will be the same, say the same for rare diseases. We must in fact do that equal recognition. But we can only do that by working together as a group. But we also need each and every country that's to advancing, we also contribute to the overall global advancement. So working together, obviously, is hugely important. So just in conclusion, thank you for the opportunity to come together with you. Certainly thank you for the opportunity to be a part of your Rare Disease Day. It's my huge congratulations to the clients, and certainly to all the leadership that they do for but also all of the support that the researchers, the clinicians, and certainly on the
Thank you, Dr. Wong-Rieger.